So it's important to look at how to integrate and apply some of these new ideas and tenets from the JJ way into what you're already doing. We're all creatures of habit, and many of us have restraints and restrictions on what we can and cannot do. So it is a bit of a learning curve to figure out how you can implement and deploy the things that you're learning about in your everyday work, in work that you may have been doing for many years, and also how you become a team player in this way, especially when the rest of your team members are not playing the same game. They're not involved or even interested perhaps in providing care or changing how they provide care in this way. So it's always important to recognize and remember that, of course, you are who you are as a clinician, whether you're a brand new clinician or whether you've been doing it for 40 years. And that's the part which you are hopefully examining now as some of this material may begin to resonate with you. And this is the part where I want to kind of share a little bit about how I think you can integrate these ways of being and continue on working in the clinical setting and in your environment. So it is a team model. And so it helps tremendously if there are other people who are like-minded around you and who are doing what they need to do. So let's talk about the team. If there is a team of like-minded folk who are working with you, working around you, working for you, great. If not, you want to consider very carefully if you're up for helping them to recognize that there are other ways and different things that can be done and supporting that change in them, or figuring out how you can be in action on your own and not impede or upset or confuse the working environment that you're in. If you're going to be going it alone, then it's very simple. You just integrate gradually, safely, and carefully what it is that you want to do different in order to fulfill on practice in this way. I use the word safe because that is one of the most important things to keep in mind. Not only should the work you do be safe for the mother, baby, family, clients, but also it has to be safe for you. You can't feel right, you can't feel comfortable, you can't feel good about your work if you're unsafe. So never put yourself in that situation of being unsafe in order to get this work done. If you find that you cannot get anything done and without being unsafe, then it's time to think about, do you want to work somewhere else? That's the bottom line, okay? So if you're in a team that's not necessarily aware or supportive or interested, then take your time and gradually integrate the things that you can do. Regardless, everybody can be kind, can be open, can listen, can empathize, can recognize, can acknowledge, can share authentically, and can provide space. Everybody, whatever their environment, whatever their team is like. One thing to try is that in doing those things the way I've just described for your patients, for your clients, you might want to, on the side, begin to apply the same thing to perhaps one of your team members or your superior or your, your employee, and just see, does that begin to make a difference anyway for them? Oftentimes it does. But let's talk about now situations where you're working inside of a team that's on board, that's ready to go, that's working with you, wants to see the transformation and is ready to dig in and get that to happen. So now you're a team leader. Well, one of the arts of this work is being a team leader without leading so clearly that everybody's like, oh, what's going on? Why all this? Who does she think or he think if they are? Like, oh, we don't want that in that we don't want any change in the dynamic, because the best team that does the best JJ work is a team where no one is ahead of anybody else, better than somebody else, more credentialed or recognized than anybody else, but rather every member is valuable, every member is acknowledged, every member is respected, every member has a part to play. Those pieces, when they come together in a team, are so beautiful, and work becomes smooth and easy, and it's like a dream. And in turn, the patients feel the benefit of that smoothness and that peace, because it becomes a lot easier. The wrangling and the back and forth tends to dissipate when the team works from a place of, we're all on the same page, we're all on the same mission, and we are all on the same level. So for some of us, especially the higher credentialed folk amongst us, that's a different way to how we might have been used to being. So for example, you may have worked or still work in an environment where the head hierarchy clinician has, more of a sort of power position. Maybe waiting till, patients roomed and patients ready and all the stuff's in place, and they don't put any hands on or any intervention until everything has been laid up and set up so they are ready to come in and do their magic and do what they do and leave. And then someone else cleans up, clears up, picks up, finishes up behind them. So that is a very typical healthcare clinician model. And the higher up the hierarchy you go, the more power you have to be in that way. In our model, that's a little bit different, because any and everybody does any and everything, right? So according to which station that you might be working at any given minute, whatever station it is, it's along the way of the journey that the mother and the family might be making through the clinic or the hospital or the environment. Whatever station that you happen to be manning, you man that station from a perspective of you are on the same level as everybody else, and you are inputting as much energy and effort and goodwill into that station as everybody else. And therefore, the 4 tenets are in play inside of that station as well, for you, for everybody else, which includes your team and the patient. So by that, I mean, let's say you're manning station 4 and you're going to be the clinician in the room. You're going to enter that room from that place of, how am I providing access for this patient's interaction today? Am I making sure that I'm accessible to her and her family or whoever her supporters are? Am I open to whatever her question is, so that I can then connect with her and share the knowledge I have about her question and end up having her feel empowered with the information I give? At the same time, how am I making sure my team member who's working alongside me, perhaps a medical assistant or a nurse, or perhaps I'm the medical assistant working alongside of a provider, but how can I make sure that everybody involved in station 4 in the room are getting the same access, connections, knowledge, and empowerment around this this interaction, and that all of us are safe? How about that for something novel? Because inside of the safety then comes quality. Inside of the quality comes the outcome. It's that simple. So we know that as a team in the JJ Way model, the team has many interchangeable parts, pieces, and areas, yet the team works from the same approach, that everybody digs in and does their part in order to support the team, as well as to support the mother-baby patient. So safety, job 1. Quality. And then as we are developing ourselves as clinicians, we're also modeling and developing the workforce. Because one of the things that happens a lot in healthcare is how quick we are to blame, chastise, be upset, annoyed with, gossip, demean this is how we behave. I mean, it's human behavior, obviously, but in healthcare, that behavior not only is destructive to teams, team building, but into individuals, of course, as well. And that also translates into how the patient is received and treated. So again, if we look at using the model to support and center the mother baby, the patient, and then work around that with our 4 tenets: access, connections, knowledge, and empowerment. If we also consider ourselves as providers and our colleagues, our teams, needing to be supported as well in order to get that done, then you see how in concentric circles, suddenly we're really providing wraparound, what I call trauma-informed care for both mother, baby, family, and for providers. Many of us have our horror stories of how we've experienced healthcare provision. You know, there's such tropes as nurses eat their young. I mean, these didn't just show up out of the, blue. They are there because historically we have all these different things that have created the way we are inside of the perinatal workforce. So we can dismantle that at the same time that we're doing this important work towards saving lives, improving outcomes, and helping move that needle towards a new and a transformed perinatal healthcare system, the maternity healthcare system. So to review, let's always keep in mind that while we work in this world, in this sphere, in this space, we are working towards the change that will bring about better and improved outcomes, safer interactions, safer environments, quality care, and therefore the eradication of disparities, racial disparities, class disparities, gender inequities, discrimination, implicit bias, explicit bias. All of it can be addressed by taking on the responsibility, the onus, and the agency for ourselves as clinicians to make this change happen. I hope that helps you.